Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the topic of pilonidal cyst. This is one of the common diseases we see in men. So it is mostly common in men. It is very rare in women. So it is seen between the ages of 10 and 30, not before that and not after that. So what exactly happens in the disease is you have a tailbone on just above the skin on your tailbone there will be a swelling. This is in the first stage and you can have pain. In the second stage what happens is there can be some watery discharge from there, or you can see pieces of hair coming out from there, and also you can see pieces of cloth or lint coming out from there, and also it get infected. Sometimes what happens is you can see the toilet paper or tissue which you have used will be coming out of that place, and sometimes it is only one opening. In advanced cases it can be more than one opening. It can go up to 6 openings. The main problem with this disease is it is a recurring disease, so it is very difficult to cure from allopathy's point of view. Once you take the allopathic treatment, there is no medical treatment for this, only surgical treatment. Once you take the surgical treatment, it will be relapsing again and again. And one more common issue is when you go with the surgery, so you have to be very careful. You cannot sit for about 1.5 month. You have to lie only on your belly for a long time, about 1.5 month to 2 months. Even you take all these precautions, there will be high chance that the sutures will come out, or there will be necrosis around the skin where the graft is done, and it will interfere with your personal life and also professional life. Coming to the signs and symptoms, there will be a sudden bump on your tailbone, and you can feel pain, and there can be a bump will open up for after some time, and there will be discharge, watery discharge coming out. You can see pus coming out from there, you can see blood coming out, you can see pieces of hair, pieces of your cloth coming out from there, and also you can see the toilet paper sometimes coming out there when you use. And what are the investigations required for this? There are no special investigations. It is only the spot diagnosis. So you can just see and say that this is pilonidal cyst, or it is sinus, or sometimes it can be complicated as abscess as well. And coming to the anatomy and histology, see, this is the infection of the skin, and especially the sweat gland and also the hair follicle. So it can be hair follicle, it can be sweat gland, and it is on the skin just above your tailbone. Coming to the etiology, or what are the reasons for this cyst? First one is sitting for a long time. If anyone is sitting for a long time, they will develop this cyst. And also presence of coarse thick hair on your back. Some people have hairy back and they will have thick hair there. It is also one of the reasons, and also it is hereditary. Sometimes it will be in your DNA as well. And coming to the risk factors, there are certain risk factors for this. First one is diabetes. If you have diabetes, you are prone to get this. And also the major risk factor is obesity, and hot and cold climate. And if you are a person who is sitting for a long time, and you are moving your butt for a long time, for example, you are a software engineer, so you are sitting for a long time, and you are a driver, so you will be sitting for a long time and moving your butt. That is a risk factors we have for this disease. Coming to the pathology, it develops as a cyst. Cyst is a closed structure where you have granulation tissue and infection inside, and it is not yet opened out. And coming to the sinus, this is the second stage of the disease where there will be opening from the cyst, and you will see the discharges coming out, and you will have a tract, and this is full of granulation inside. It is difficult to heal, and you can see pus coming out from there, or pieces of cloth coming out from there, hair coming out from there, toilet paper coming out from there, and other things may also accumulate in that cyst. The next stage is abscess. Once the cyst is there, if it is neglected, if it is not taken care, it can become highly infected, and you can see the abscess. Abscess is a pus surrounded with the granulation tissue. When you sit, or when you have big bumps, or when you have obesity, so when you sit for a long time, what happens is the skin will stretch just above your tailbone. This will stretch the any hair follicle there, or any sweat gland there, they increase in size, and sweat and also the hair start accumulating there, and also sweat will accumulate there, hair will accumulate there, and also pieces of your cloth that we call lint, right? This is going to accumulate within your buttocks. And also sometimes the toilet paper, if you have the habit of using the wiping with the toilet paper after you pass the stool, so even that toilet paper is going to accumulate in that expanded or enlarged hair follicle or sweat gland. So then it becomes infected. So and there will be a granulation tissue development, so you will have pain. In the second stage, the cyst will open and discharge pus, it will discharge hair in it, and also it will discharge toilet paper, lint, whatever is accumulated. And all these materials will act as a foreign body, and they can irritate the tissue or can damage a hair follicle or sweat gland. In next stage, what happens is this sinus will open, and this sinus will extend upwards from one place. It is going to extend upwards from your just above your tailbone. Then what happens is there will be multiple sinus, there will be multiple openings on your skin. This can be ranging from one opening to multiple openings, and the area becomes big. Similar kind of pilonidal cyst you can see around your umbilical area or near your axilla, or you can sometimes see on your face as well. This is one of the commonest diseases. It can be seen in the web of your fingers, sometimes in the web of your toes as well. So but the pathology is same, the locations are many, but the most common one is just above your tailbone, the skin above your tailbone. And coming to the conventional treatment, there is no medical treatment, and the only option they have is surgery. There are three types of surgeries. First one is open surgery. In this one, what happens is they will cut a large piece of skin above your tailbone, and they will remove that. The problem with this is the disease can recur again and again, and healing is very difficult when you remove the large portion of your skin above your tailbone, where you cannot sit for a long time, where you cannot sit at least 2 months to 3 months. You cannot sit, you have to lay on your belly only. So you have to lay flat on your belly. It will affect your work, it will affect your personal life. This is not the best option you have, and it is full of side effects. It can get infected, the pain may increase, you have to use painkillers. Because of painkillers and antibiotics, you will have a lot of side effects as well. And coming to the flap surgery is there will be a big opening on your just above your tailbone, and skin from other place, skin just beside the tailbone is cut and put as a flap and sutured it. So this is the second best one, but it is full of complications. It is highly possible that the sutures will come off, and also there will be necrosis and death of the flap or the skin which is healthy. And you cannot go for your work or do your personal things for a very long time. So maybe you have to take rest for at least 1 month to 1.5 month, and in this 2 months you cannot sit properly. You have to lay down on your belly, and you have to wait for the wound to heal. Sometimes it may not heal, it will reoccur, and even this is very painful, and you have to use antibiotics and painkillers which have a lot of side effects as well. And coming to the third procedure in allopathy or western form of treatment, what happens in laser treatment is they will take a scapula and cut the tracks. All the sinus are removed. Once the sinus are removed, they will use a laser and burn your skin inside of your sinus. They will try to burn your skin so that it comes together and heals. This is one of the painful procedures, and even with this there is high chance that it will recur again and again. You have to use antibiotics, you have to use painkillers here. So this is the treatment you take when you have pilonidal cyst, and you go to a doctor who is nearby your home, or you go to a specialist or a general surgeon. And also this is also called English form of treatment, western form of treatment, or allopathic way of treatment. Allopathic way of treatment is not good in this case because of lot of side effects. Even if you go with all these surgeries, so there is high chance that it will recur again and again. And every time when it recurs, the wound you are going to cut will increase. It will increase in size and it will increase in depth. So healing will be delayed, and you will be leading into lots of complications. And coming to the homeopathic treatment, how homeopathy can help you in this regard. So homeopathy has excellent medicines. Without any surgery, you can cure this spinal sinus completely. Even it is in first stage, whether it is in the just in the form of cyst, there is no opening, and also when it is a simple cyst where there is only one opening, or it is a multiple cyst. When you have multiple cysts and the pus is coming out, and the hair is coming out, tissue paper is coming out, everything is coming out, even that stage you have excellent medicines. In this, you can not only cure the existing one, you can ensure that this is not coming again and again. So whatever the risk factors are there, those risk factors can be eliminated with homeopathy. And also you can ensure that all this is without any side effects. So not only curing it, you can prevent it. And also one more thing is, you have gone for the surgery and you are facing the challenge that you are, after the surgery it is coming and again. Even in that stage, homeopathy can help you so that this pilonidal cyst or sinus will not come again and again. All this is without any side effects in homeopathy. Homeopathy, there are no side effects, and also you can treat this with very less price. So compared to surgery and the discomfort you are going through when you are having the surgery, it is much affordable and much cheaper compared to allopathic way of treatment. And also there is no need for you to take rest for a long time, and there is no chance of complicating it again and again. Without rest, doing all your personal activities, doing all your professional activities, you can still take the homeopathic treatment. And in this regard, homeopathy is the best option in front of you for pilonidal sinus or cyst. And coming to the precautions, what precautions you have to take. So if you are sitting for a long time, don't sit, try to move. If you are obese, try to reduce your obesity. And also ensure that your hair is completely removed from your back. When you have pilonidal sinus, remove the hair on your back, regularly shave it, and also use the powder or talcum powder to keep the area dry. And also have some physical activity. Use the ring pillow. Ring pillow is a pillow where you have small opening in the center of the pillow. You can sit on that pillow so that there will not be pressure on your posterior part of your buttocks. If you are in warm and moist environment, ensure that you come out of that environment, or you can maintain dryness around your buttocks region. And also if you are a driver, ensure that you drive less. And with all these precautions, you can ensure that the pilonidal sinus is not coming again and again, or when you have the sinus, it is cured fast. Apart from this, have good diet, have a healthy diet, and also have regular sleep. And also you need to exercise regularly and lead a stress free life, so that your immunity will be improved and you will not land into these type of complications. Coming to prognosis, what happens when you neglect the pilonidal sinus or cyst? First, initially it will be a small cyst, then it will be converted into simple sinus where there is only one opening and discharge is coming out. If you still don't take care of it, there can be multiple openings. The wound becomes big, the area becomes larger. Every time you go for allopathic surgery, the cut you have to make, it will go deeper and it will be larger, so that this becomes a complication here. So take care of it. When you find symptoms of pilonidal sinus, immediately reach to us so that we can handle it from there. We are Fidicus Homeopathy. We offer you two types of treatment. One is online treatment and in-person treatment. In online treatment, we will ensure that your complete case is taken, and we will send the medication to your doorsteps. You can use it and report it every week. You can also come to our clinic. We are located in Manikonda, Hyderabad, for personalized treatment. Thank you.